Okay, so this is Grizzly, and he's here for his checkup. And Grizzly had an acute liver failure. His enzymes were 2,205, and he had a liver biopsy, and he had chronic active hepatitis, but they didn't know what caused it or how to reverse it. He was on several medications, lots of medications, and he was not eating, he just wasn't thriving, he was actually losing a lot of weight, and just really on the verge of not getting over this. So the mama decided we're not going to let Grizzly, just 2-year-old baby, he said, we're not going to let him go, so we tried to do integrated medicine. So we added to what the traditional doctor was trying to do to jumpstart the liver. We added acupuncture. We follow food therapy, acupuncture, or acupuncture, putting B12 on the spots of the liver, trying to regenerate the liver. And then we did milk thistle and turmeric and liver chews, which are a special preparation that has SAM-E and a couple of other antioxidants for his liver. So basically we were doing supported by mainly by diet and supplements. And this is him, what, 1 month after?
Yeah, he had three treatments.
Treatments.
Yeah, it's been about 4 weeks now.
Yes, and we were doing acupuncture. We were repeating the same spots, and then we were going to check the liver enzymes. And his ALT went from 2,205 to 107, which is the normal. It's between 12 and 118, and the normal is 107.
Right.
He still has some inflammation, and some inflammation mainly on his bile ducts, and we are going to continue Versadiol, which is a conventional medicine for bile ducts, and then we're going to continue milk thistle, the turmeric, which is a natural anti-inflammatory. His diet is changed, basically a low protein, mostly vegetal protein, not animal protein. And I think that should continue for his life, because it's just going to help tremendously. I think that we came back to the liver is fine. Today we're going to do acupuncture for his bile ducts. Okay. There is a different point for bile ducts, and we were not hitting those. Okay. We're going to do inflammatory points and bile ducts, and that shall help him steer him into recovery of those parts as well.
Great.
So if you hear of anybody, with him being that he was so severely sick and wasn't responding to conventional therapy, would you hesitate, or would you have any concerns about suggesting to another person that will come to you?
Oh, no. No, I think the decision we made to get a second opinion and do further treatment was the right decision, and he responded immediately to the additional therapy and the extra food and other things you had suggested, and I would do it all again, and I would definitely recommend that to other people as well. He's just done phenomenally well. Even the other doctor was amazed at how well his blood work had come back just after a month.
Yeah. And this is the thing that we wanted to tell people out there, that if you're giving a diagnosis of failure, which he had, is with liver failure, that some organs, we can jumpstart. There's stuff that we can try, and it's very low tech, non-invasive, and he tolerated it with no problem.
Oh yeah.
He got lots of food while he got it, so it was enjoyable for him.
Peanut butter.
Yeah, and it was at a fraction of a cost of all the other procedures. By the time you came to me, you had to spend a lot of money trying to just find the diagnosis. So that's an alternative, definitely, to euthanasia. So, and definitely, he's a young guy, and he's would tell me I remember within the first week, just the diet change, and he was describe what you noticed immediately.
He had more energy immediately. Just was acting more himself, getting his full personality back. Just really good appetite. He enjoyed the vegetables and other food we were giving him, and and then just each week he just kept getting better and better. And I'd say, last week we were saying, he's back to his old self.
Yep. Well, thank you so much, and like I said, this is